This video is titled, Masturbation Will Give You Cigar Mouth. According to Happeh Theory, masturbation will make a human being blind and crippled, as well as causing many other health problems. One of those other health problems is a condition which Happeh Theory has named cigar mouth. One side of the mouth of an individual with cigar mouth will be wider than the other side of their mouth, like the side of the mouth of someone smoking a cigar is wider than the other side of their mouth. This picture demonstrates what the mouth of a cigar smoker looks like. The side of the mouth with a cigar in it is open much wider than the other side of the mouth is. This picture shows an individual who has a mild case of cigar mouth. The right side of his mouth is just a little bit taller than the left side of his mouth is. The outside of the right side of the mouth is also farther away from the right teeth than the outside of the left side of the mouth is from the left teeth. The large vertical distance between the right side of the upper and lower lip and the large horizontal distance between the teeth and the outside of the right side of the mouth combine to form the most visible sign of a case of cigar mouth, a dark-looking hole in the side of the mouth. This picture shows an individual with a more pronounced case of cigar mouth. The dark hole in the side of this individual's mouth is much larger than the dark hole in the side of the mouth of the man with only a mild case of cigar mouth. The larger dark hole in the side of the mouth of the man with a more pronounced case of cigar mouth makes it easier to understand why this condition was named cigar mouth. This picture compares the cigar smoker to the man with a more pronounced case of cigar mouth. A cigar fits perfectly into the dark hole in the mouth of the man with cigar mouth and makes him look like the actual cigar smoker. Not all cigar smokers hold a cigar in the side of their mouth, with only that side of the mouth wide open. Some cigar smokers will open their entire mouth wide, as shown in this picture, or as in this picture. Masturbation-caused cigar mouth can also look like an individual smoking a cigar with a wide open mouth. The individual in this picture has masturbation-caused cigar mouth, and it is wide open like the man smoking a cigar with a wide open mouth. If a cigar is inserted in the mouth of the man with masturbation-caused cigar mouth, his mouth looks like the mouth of the actual cigar smoker. The development of cigar mouth includes a distortion to the shape of the tongue. The right side of the man's tongue has a distorted look compared to the left side of the tongue. The effects on the tongue of a case of cigar mouth can be so strong that some individuals with a wide open mouth type of cigar mouth will have a tendency to stick their tongue out through the cigar mouth hole, as shown in this picture, or as in this picture. A cigar would fit perfectly in the same spot as the tongue in both of those examples, making them look like the wide open mouth type of cigar smoker. Cigar mouth is the result of the tightening and shrinking of certain parts of the body. According to Happeh Theory, the main overall effect that masturbation has on the human body is to tighten and shrink the human body in a particular pattern that is dependent on which hand is used for masturbation and exactly how the hand is used for masturbation. The masturbation-caused tightening and shrinking of the head can be so severe that the muscles that control the jaw will no longer work properly. The muscles on the side of the mouth that has a case of cigar mouth will pull the jaw over towards that side of the body, which makes the dark hole in the cigar mouth side of the mouth look even bigger. This picture shows an individual with a strong case of masturbation-caused cigar mouth. The masturbation-caused shrinkage of his head has pulled his jaw to his right, which makes the cigar mouth opening in his mouth very large. This picture shows how perfectly a cigar fits into the large cigar mouth opening in his mouth. Here is another case of cigar mouth with jaw distortion. The individual's jaw has been pulled to his right, which has distorted the shape of his lower lip. The curved shape of the lower lip looks like it fits exactly around the curve of a cigar. According to Happeh Theory, the jaw distortion caused by masturbation is related to a medical condition called TMJ, or temporomandibular joint disorder. Temporomandibular joint disorder is a fancy way of saying the muscles that control the jaw are not working properly. The literature released by doctors and scientists about TMJ indicate that they have no clue about the connection between masturbation and the development of TMJ. The previous pictures put a cigar into the mouth of individuals with cigar mouth to demonstrate the inspiration for naming the condition cigar mouth. The hole in the side of the mouth of an individual with masturbation-caused cigar mouth looks like the hole in the mouth of a cigar smoker. According to Happeh Theory, that similarity inspires some individuals to use a cigar as a cosmetic accessory to cover up the dark hole in the side of their mouth, and if they have a severe case of cigar mouth, to cover up the distorted appearance of their jaw. This picture shows an individual with a severe case of cigar mouth who is most likely using a cigar to cosmetically cover the large cigar mouth hole in the right side of his mouth and the movement of his jaw to his right. There is another equally likely reason that explains why this individual is holding a cigar in his mouth. The tightening and shrinking of the body that causes cigar mouth also causes pain and discomfort to the body. According to Happeh Theory, some individuals will take up cigar smoking because holding a cigar in the cigar mouth hole in their mouth acts to relieve the pain and discomfort associated with cigar mouth. This picture is an example of an individual who uses a cigar as a means of therapy for the pain and discomfort associated with masturbation-caused cigar mouth. The angle of the head will put an abnormal pressure on the teeth in the right side of the mouth. That would cause pain and discomfort that a doctor would probably diagnose as a case of TMJ. Holding a cigar in the right side of the mouth separates the teeth, which will relieve some of the pain and discomfort associated with cigar mouth by moving the jaw back to a more properly aligned position. More importantly, holding a cigar in the right side of the mouth acts as a cushion for the teeth and jaw on the right side of the mouth. The masturbation tightened muscles of the head continuously apply a strong clamping force to the jaw that grinds the teeth together. The large diameter cigar absorbs and dampens those clamping forces like a car shock absorber, which protects the teeth from jaw grinding caused erosion of the teeth. An individual with cigar mouth does not have to use a cigar to fill the hole in their mouth. According to Happeh Theory, some individuals with cigar mouth will begin to feel a desire to perform gay oral sex because that is an instinctive way to deal with the pain and discomfort associated with a case of cigar mouth. Instead of filling the cigar mouth hole in the side of their mouth with a large diameter cigar, gay oral sex fills the cigar mouth hole with the large diameter of a penis. Individuals in this situation usually do not know that they have cigar mouth, and they usually do not know that the urge they feel to perform gay oral sex is a bodily desire to gain relief from the pain and discomfort associated with cigar mouth, and not the mental desire of a homosexual man who wants to perform gay oral sex. It is necessary to be very careful when diagnosing the cause of a case of cigar mouth. This picture shows a muscular man with a cigar in his mouth. A logical conclusion based on what has been said in this video is that the individual has a cigar in his mouth because he is using it to hide, or is using it as therapy for, a case of masturbation-caused cigar mouth. That conclusion would be wrong. There are other activities that can cause the same type of changes to the human body that masturbation will cause to the human body. According to Happeh Theory, anorexia, injection of drugs, snorting of drugs, excessive sex, homosexuality, and excessive exercise are all associated with the same or similar changes to the human body as those caused by masturbation. Since the man in this picture is a bodybuilder, it is much more likely that he is holding a cigar in his mouth to relieve the pain and discomfort of an excessive exercise-caused cigar mouth and not a masturbation-caused cigar mouth. This picture shows an extremely severe case of excessive exercise-caused cigar mouth that demonstrates how an excessive exercise-caused cigar mouth can exhibit the same jaw distortion that occurs in masturbation-caused cigar mouth. And finally, this picture shows an example of an anorexia-caused cigar mouth that could also be caused or influenced by excessive exercise.